Go ahead now, call Oregon State Board of Nursing. We have Philippa Nesta, Rachel Mitzel, Rachel Dennis.
Chair Jama, Chair Bona, and members of the committee. My name is Philippa Nesta. I'm a resident of Happy Valley, Oregon, and I work for Kaiser Permanente at the Sunnyside campus. I worked in the ICU for 17 years and then continued schooling at Concord as an LPN. I am proud to be considered for a seat on the Oregon State Board of Nursing representing licensed practical nurses. I've worked in healthcare since the 1990s, following my mother into the profession. To do this work, you have to have a big heart and care about people that we serve. I have seen this in action on both the business and clinical side of our hospital. I joined Kaiser as a medical record specialist, and after raising my children, became an LPN to better support a team of healthcare professionals serving my community. I strongly support the board's mission. This mission matches my motivation to join our care teams during the COVID pandemic. I was part of a team in our ICU that put up a whole unit within a 24-hour period and worked through the entire pandemic. I want to support our care teams in this role because I have seen how all of us working across licensed professions can deliver the care that we need despite the most challenging circumstances. Our nursing team needs support to continue to care for our communities, and I look forward to joining the OSBN team to support its mission and the nursing professionals that we work with. I appreciate the opportunity to serve the people of Oregon and the profession in this role.
Thank you, Chair Jama and members of the committee. My name is Rachel Mitzel. I'm a registered nurse, a certified registered nurse anesthetist, and a psychiatric mental health nurse practitioner. I currently serve on as the treasurer for the JBAR-J Youth Services Board in Central Oregon and as a member of the Oregon Association of Nurse Anesthetists. I'm delighted to be here today as a mother of three, a wife, a community member of Crook County, a business owner in Deschutes County, and I've been providing healthcare for Oregonians for over 15 years. As a candidate for the State Board of Nursing, I hope to bring my experience, my leadership, and enthusiasm to further strengthen our board and advocate for the evolving needs of nurses and patients alike. I'm committed to educating and recruiting young people into this great profession, and I recently have transitioned to a specialty in mental health in response to an increasing demand for providers in my community. I know that 60 seconds isn't a long time to get to know somebody, but I hope that I can give you some confidence in moving my nomination forward. Thank you so much for this opportunity to be here today.
Thank you, Chair Jama and members of the committee. My name is Rachel Dennis, and I am from Springfield. I have been a CNA since 2013. I have worked at Sacred Heart River Bend for over 11 years. I started in the float pool where I was able to experience all the areas of our hospital. After a few years, I found my place working on the cardiac surgery unit and specialized in watching heart rhythms. I am a proud member, steward, and executive board member of SEIU Local 49, which represents healthcare workers in Oregon and Southwest Washington. I come from a healthcare family. My father worked his way from a CNA to an RN in my youth, and my sister and mother have both worked in healthcare for many years. As the world changes, especially the world of healthcare, I want to make sure that we are progressing towards the future. We know that there is a shortage of nurses and nursing assistants, and that as our population ages, we will need even more. Serving as the CNA representative on the Oregon State Board of Nursing is critical because we are part of the team that at times gets overlooked. I want to be part of OSBN to represent CNA interests on the board and to help protect the public. Thank you for your time, and I look forward to this opportunity.
Thank you. Questions? Seeing none, thank you so much for your testimony.